Good afternoon, everyone. Thank you so much for joining us for our webinar this afternoon. This is a webinar sponsored by the Section of Medical Education of the American Thoracic Society. Next slide. My name is Vinayak Jain. I am a fellow in pulmonary and critical care medicine at the University of Oklahoma, and I'll be your moderator for this afternoon. Next slide. Before we actually go ahead with our webinar, just wanted to highlight some of the webinars and sessions that the section of medical education has done over the last year. All of these are available on the YouTube channel of American Thoracic Society for free. So all of you can actually go ahead and take a look at some of the interesting webinars, as well as on the next slide, some of the webinars that are planned for the next 1 or 2 months. So if you have not registered, you probably should go ahead and definitely register for these. Next slide. For our specific webinar, the topic of today is institutional support for MedEd, strategies for early and mid-career scholars. And the idea behind this is really, looking at how we are seeing the changing landscape in academic medicine, how there is a focus on education along with research and patient care. But unfortunately, when it comes to actually support and buy-in for that education aspect, there is a lot left to be desired. So we were just hoping to really look at some of the challenges that educators feel or encounter as they navigate through this landscape. And when I say education, the focus of education on academic medicine, I don't just mean traditional metrics like scholarship, but also curricular innovation, teaching, mentorship. All those things are equally important as well. And for this webinar specifically, we have two of our wonderful speakers. In the next slide. First, we have Dr. Zareen Zaidi, who's a professor of medicine. She is a professor of medicine at GW. She has an exceptional track record when it comes to MedEd scholarship, both in doing it herself as well as mentoring a number of rising scholars, as she's done in the AAMC's MedEd Scholar Program. We also have Dr. Elizabeth Batchelor, who is an Associate Program Director of Pulmonary and Critical Medicine, as well as Associate Vice Chair of Education at the Eastern Virginia Medical School in Old Dominion University. And she has an excellent track record as well when it comes to GME specific initiatives for residents and fellows. So without much further ado, I'll go ahead and have my speakers take away for the rest of the session.
Thank you so much, Dr. Jan, for inviting Dr. Batchelor and myself. We're very excited to be here. Good afternoon, everyone. Today's agenda is that we are going to talk about individual and institutional strategies to promote medical education, research, and scholarship. We're going to sort of ground all of what we are saying in scholarly frameworks, and we're going to provide some key takeaway points. So let's begin by sharing a little bit about who we are. So for myself, I am an internal medicine primary care provider. I teach medical students, residents, other allied healthcare professionals. Somewhere down the road, of course, I realized that my predominant interest was as a clinician educator, and therefore I started dabbling in research related to teaching and learning. And that's how I think I began to form my researcher identity. And then over time, this has developed into some leadership positions. I've served as director scholarship, director portfolios. I'm currently the co-director of the Academy of Education Scholars at GW and associate director of educational scholarship for the College of Medicine. Over to you, Beth.
Yeah, and again, thank you so much for having us. I'm hoping to be a little bit more of an in the thick of things with you participant and panelist in this. So I'm obviously also a clinician. I'm a pulmonary and critical care physician. I finished fellowship in 2020. So I think by all definitions for my pride, I'm still considered early career. Obviously, a lot more of my focus is more in leadership and mentorship and curricular design. So I lean very heavily in the clinician and educator. And I'm sure, like some of you, am still working to make that researcher aspect still a substantial part of what I do. So I'm hoping I can be relatable as we talk about things today.
Awesome. So let's kickstart this by asking you, what obstacles do you face while undertaking medical education research and scholarship? So we have a QR code, and I'm going to leave this on for a few seconds. Scan it with your phone, and this will take you to a web page called Padlet. You do not have to create like a profile or login. If you're using your phone, you'll see at the bottom a sticky note with a turned corner. If you're doing this on your laptop, you will see it on your right-hand side. Click the sticky note. It might ask you to select a color, then drag the sticky note onto the main screen and enlarge it by pulling the corners and go ahead and tell us what obstacles do you face while undertaking research and scholarship. And I'm going to give this a couple of more seconds, and then I'm going to share the Padlet screen so that we can see your responses in real time. If by chance somebody is having difficulty getting to Padlet, you can just type in your responses in the chat box, in the Q&A section. All right, let me share screen. One person said getting published is an obstacle, time, grant support, time, mentorship, quantitative methods. Let's see this. Let me see if I can shrink this a little bit.
I appreciate the getting the writing done.
Oh gosh, yeah, that's always a big one.
And Beth has shared the link to the Padlet on the chat as well, if someone was not able to scan the QR code.
So somebody said, can everybody see the screen? It's not a big deal. Let's see. One person has one person that getting published as an obstacle, time, grant support, mentorship, quantitative methods. I appreciate the writing done. Yeah, okay.
I think
So
it's transcribing us.
here's
Yes.
another one, finding collaborators, then time management, knowledge on how to proceed, funding, time is another one. Okay, so let's see how this compares to what the literature says.